or you want to wait, or if you want to get started.
I would like to get started. I think it'd be
Okay,
good.
awesome. Well, welcome everyone to officially a Welcome Home All Fall session. This is non-medication ways to deal with brain health with Dr. Divya Kakaiya, and I will pass it over to her to get started.
Wonderful. Thank you. Thank you so much. Thank you. Good to be here. I have as many of you may know, I kind of have a preference for being able to see people's faces. So if anybody kind of wants to show up and be present, that would be great. I love seeing it, and it's good to see you again. Very nice to see everybody. Oh, good. I'm seeing more. Valerie's there. Very good. Nice to see you. And Judy is here. Very good. Judy, good to see you. Judy was the one that walked my daughter through her gold award. So we will be eternally grateful to Judy over here. Good to see everybody. I'm very excited about presenting to all of you. And for those of you that don't know my background, I'm an integrative psychologist who is also very much not in the field of talk therapy at all now. The only thing I do in my practice is brain treatment, which is neurofeedback. So that's like my primary forte. So I have my PhD, and then I have a postdoctoral degree that's a Master of Science in Psychopharmacology. And what that degree did is prepared me to be able to prescribe medications. So when I went through a whole 2.5-year course, learning about medications and learning about all the systems and learning about those kinds of things, I kind of actually made a U-turn from all that knowledge that I was gaining into becoming more of an integrative psychologist. So that's where I moved much more into brain training. So that's just a tiny bit about my background, which will help all of you understand why I come from presenting the kinds of things I do. And daughter, who is a Gold Award recipient, and then I also have a son who received the Eagle. So we're very much a scouting family, and I'm on the board of Girl Scouts and also a lifetime Girl Scout. And I was a Girl Scout Girl Guide in Kenya, in East Africa, when I was growing up. So, scouting is guiding is Girl Scouting, guiding is very much in our family. So that's just something for all of you to know. And I think I was counting, I think this might be my 13th year that I'm doing the volunteer conference. So I've usually done 2 sessions, as many of you know. And then, I just love coaching my families about brain health and all the things we can do to make our girls and our families healthy. So this is all about all of us, including mamas, So we didn't hear about neurofeedback in grad school. What I do today was nothing I'd heard about in grad school. Now the graduate schools tend to talk about neurofeedback, which is a type of brain. Think about neurofeedback as physical therapy for the brain. So to me, that's like my biggest go-to that regulates the brain. What brought me to this world was my son with his inattentive ADD. And when he was in 6th grade, I knew I didn't want to put him on any medication. That was like super clear for me, that I didn't want to put him on any meds. And so as a result of that is how I met a friend who's doing neurofeedback on her sons and raving about it. I took my son to her for a whole year, and lo and behold, here we are, without having medicated any part of the ADD along the way. So that just makes me feel like super positive about what we do, and just with my practice here too. I have a huge pet peeve, and that is how over-medicated our country is. So right now, with us having gone through the pandemic, what's happening is that lots of teens, young women, children, girls, boys are struggling with anxiety, struggling with depression, struggling with school avoidance. There's a lot of issues that people are having a hard time with right now. And as soon as you talk to your pediatrician, or the first thing they're going to suggest will be some medications. And so we've become too trigger happy with meds. So one of the things I want to do today is really speak with all of you about all of these other things we can do overall to regulate a brain without medication. So there's just a whole lot we can do. So I'm a very complementary perspective is what we have here. And I'm also, I think, I'm curious. I would love to see, maybe you could, maybe you can put thumbs up or a thing on your thing. How many of you have been reading the, listening or hearing about the Facebook and the Instagram posts? Everything. Hilda. Mm-hmm. Mm-hmm. Anybody else seen anything about Facebook? Okay. Yeah, it's huge. So Facebook has been collecting a lot of data that is pointing to the impact it's having on the self-esteem and body image of girls. And what it's sort of like the information that a lot of the tobacco companies had, that they were not sharing, while they knew that there were cancers that were being produced with the tobacco. So if you look up Wall Street Journal, there's a lot of articles in Wall Street Journal about all of the deceptive practices that Facebook and Instagram has had. So it's important as parents that we read up about that, because it's like very fresh. Only about 8 or 10 days old is this hot story. I have a bias about how we've gotten very disconnected because we have so much tech. And then, when the pandemic happened, we ended up needing to allow like unlimited amounts of screen time with our kids. So that was very difficult for us. So I love talking about brain health versus mental health. Okay. So if we think about it, we have, this is a really big way in which we stigmatize mental health, right? Because when we talk about mental health, most of us tend to get extremely like shut down about the whole issue. So when we stigmatize mental health, we think about mental health as a sign of weakness, which it's not. And so anytime we stigmatize anything, it is a mark of disgrace that tends to set a person apart from others. So any of our teens, or even us, when we're having any issues with anxiety or depression or mood issues or attention issues or something, because when we call it a mental health disorder, we tend to stigmatize people. And in my book, the only way we can remove stigma is through education. And we've got to continue to think about how mental illness is not a sign of weakness, not a sign of weakness at all. And we've got to be able to reduce that stigma. It's very important. So I am a big one in terms of constantly talking about mental health. I don't talk about mental health. You'll just hear me talk about brain health, brain health, brain health, brain health. Okay. So when we look here, there are certain factors that tend to, let me bring this little guy down here. So he's hanging out at the bottom, so he's not at the top. There we go. Okay. So all of the factors that tend to affect brain health are all of these factors, right? Our lifestyle, what we do in our daily routines, how we are day to day, what kind of food do we eat? What is our nutrition like? What is our cuisine? Genetics are a huge factor with brain health. If we carry heart disease genetically, why would we not carry some brain conditions genetically, right? So we've got to think about the genetics with brain health. And epigenetics is this huge area that we talk about, that today I could be genetically loaded up with high cholesterol coming down from my family, but everything I do in my lifestyle and my diet and my management of my stress, all the lifestyle changes that I make in order to dial down my genetics, is called epigenetics. So we could be loaded up with a certain genetic factor, and there's a lot that we are in charge of that we can do that settles down the genetic pieces. Stress, genetics, environment, all impact the brain health. Medical care, what kinds of drugs do we take? What sorts of services are we getting? And really, when we look at brain health, we have to look at the socioeconomic groups that we come from. And we know that what's happened is that there's a big disparity about, how the environmental conditions affect. So for example, when we look at some of our areas in town that have the most amount of pollution, or where there's a lot of pollution, will be some of our low socioeconomic environments. Then in the air, you have a lot of pollution in the air, which causes a lot of brain conditions, such as dementia, such as Alzheimer's. So we really want to take a look at that environment that we live in, because the environment, when we surround ourselves with nature and trees, that makes a big difference in terms of brain health as well for ourselves. So we really want to see the interplay of all of these factors towards our brain health. So statistically, there are over 300 million people around the globe who are affected by depression, okay? 600 million bipolar illness, 23 million schizophrenia. Clinical anxiety, 250 million people in the world. And get this, guys, only 5.6% of our budget is spent on mental health. And we all know that when the brain is healthy, the body will be healthy. So we really want to be thinking about the health of the brain, and how does the health of the brain affect the health of the body? Because the brain is the CEO of the body. So you really want to be thinking about it from that perspective, right? Huge pet peeve. 2015, $21.7 billion. Prescription drugs. Abilify, sorry, that should be Abilify, and Zymbalta were the most prescribed. And what we find with these medications is there are lots of side effects, negative side effects. So I'll bring up some of the side effects. So there's so much more that we have available in a non-pharma way. And I want us to move away from this quick fix mentality that we have. Regulating brain health is going to take time. If you've been given a diagnosis of high cholesterol, you're going to have to spend about 6 months really making some very substantial lifestyle changes in order for your cholesterol levels to drop to where you want them to be. In the same way, if you're dealing with a brain condition such as anxiety, you're going to have to do 6 months of a certain prescribed recommendations that I'm going to give along the way here that'll allow the brain to get to a healthier place. The brain is a beautiful neuroplastic organ. It wants to be well. It wants to be happy. It does not like it when it's in disarray. And think about how the brain is an organ of the body. The brain is an organ. And how come that every other organ in your body can get sick and get sympathy from everybody? But when our brain gets sick, we don't get sympathy. Instead, we tend to get stigma. So this is a TED speaker. She's got a really good speech about the stigma of our brain health. Our brains are incredible organs, but when we put too much upon our brains, again, our brains are going to be prone to disease. Just as if we put too much upon our heart, if we put too much on our kidneys, if we put too much on our liver, those will be prone to dis-ease as well. In the same way, the brain would be prone to dis-ease, right? So the next slide is showing all the functions of the brain and the various regions of the brain. When we're looking at a hormone system, we're looking at the thyroid hormone, we're going to be looking at estrogen, we're going to look at progesterone, we're going to look at testosterone, we'll be looking at all the hormonal systems, right? So then with the brain, we have to see all the functions that the brain controls and think about how when you have your frontal lobe that is involved in the thinking, the planning, the problem solving, emotions, behavioral control, that if any part of that frontal lobe, which is number one over there, is in disarray, that's going to bring about a lot of shifts in the brain where a person may have difficulty making decisions. They may not be able to decide. Like you have somebody whose brain gets locked on and they have difficulty deciding. A lot of that is frontal lobe imbalance. The parietal lobe is the lobe back over here, where it's about our perception of the world, how we classify objects, our spelling, our knowledge of numbers, the visual spatial processing. That's all in that parietal lobe, number 2 over there. Number 3 is your occipital lobe. That's the one involved for vision, for visual processing, color identification. So you can see that if we get a hit to the brain or something happens and your kid gets a concussion and they've just been hit in the back, or the back has been hit, and they may have a lot of visual sensitivity, they're going to struggle with things. Also, if you end up having any imbalances in the brain, like say number 2, the parietal lobe, that's where you'll have sensory processing issues, sensory processing difficulties, and those kinds of things, which are brain conditions. They're not mental health conditions. These are brain conditions, because you can see it's a beautiful, gorgeous, complex organ that we have over here, right? And then the temporal lobe is in this area of the brain, this region of the brain. It's our memory, it's our understanding language, it's facial recognition, hearing, vision, speech, emotion. So the temporal lobe is very much about emotion activation, right? So if you have temporal lobe instabilities, you're going to see a child who may be very emotional, who may be very reactive. There may be a lot going on for them. So you don't instantly want the psychiatrist to just be, because what the psychiatrists do when you take a child to see them is they play this game called Pin the Donkey's Tail. Remember, you guys remember that game, Pin the Donkey's Tail? Okay. So they're just guessing at it. And guys, I kid you not, I have treated so many people here with neurofeedback where they've been on 8 or 10 different medications. My child is only 15 years old at this point, okay? They've been on 6 or 8 different medications, because it's like a shot in the dark. The psychiatrist is just trying to guess at what might be effective for this child. You start having negative side effects, and they put you on another one. You have negative side effects, and I've had kids who have been on medications for 2 or 3 years, and they've gotten worse along the way. They're not improving. There may be that temporary boost you get for about a month or so, but after that, they're not improving. So cerebellum is this area of the brain back here, number 5, which is your gross and fine motor skills. So you might have a kid who's very hyperactive, right? There's a lot of hyperactivity. So I'm going to be in the parietal lobe. I'm also going to be in this region over here doing some work in those areas, right? And then we know that anytime we have any kind of brainstem damage to the brain, which is number 6, that's when you can die. I mean, any damage to the brain is what kills us. That's where we also get paralyzed. So that's a very, very significant part of the brain. So any imbalances, so when we call mental health conditions as brain disorders, we're changing how we talk about brain disorders, okay? We're not going to put them in the category of she can control it, or she's so weak that she cannot handle it. We're not going to talk about it that way. We're going to, when we get help for a brain condition, it is at the same level of getting help for a broken leg or a cancerous tumor. I really want us to work on reducing the stigma. And addictions are brain conditions. ADHD is a brain condition. Depression and anxiety are brain conditions. So really let that settle in for yourself, right? So the risk, what puts us at risk for brain health dysregularities would be the genetics that we inherit from our family members, the biology, what's going on within our brain, within our body, with our nutrition. Are we having proper absorption of iron? Is there a good balance in our body biologically? And that's why when you're working with somebody who's an integrative type of a doctor, they're going to work on micronutrients in the body, because there's a lot that happens in the biology that we can change around without putting anybody on any medication. We can do the testing and we can balance out the biology of the child or yourself or anything like that. Big risk factor is poor diet, substance abuse, lack of exercise, irregular sleep patterns. Now you tell me if this stuff did not happen to our kids during the pandemic, right? So are we not going to be at risk, at a high risk for some brain health issues? We're going to be. And so we just say, what are the things we can start to do in our family where we start to regulate our family so that we can start to mitigate these risk factors, because these risk factors can be mitigated. Environment, another huge risk factor for brain health dysregularities would be the environment. If we've been exposed to traumatic events like COVID, if we've had sudden loss, if we have violence, if we've had abuse or neglect, if we live in unsafe communities, and if we come from low socioeconomic status, because we know then we're just dealing with survival issues, and it's difficult for us to bring about really good, healthy brain behaviors if we're just on core survival. So what we inherit, what our actual biology is in our body, what our lifestyles are, and then what our environment brings for us. Those are all factors that put us at risk for brain conditions. So what I find is that there are some psychological, biological, and environmental factors that affect depression and anxiety. And the reason I want us to understand all this from a complex way like this, a multidimensional way, is because it isn't typically one thing that tends to cause depression, or it may not be one thing that causes anxiety. It could be a bunch of these factors. So you could have, so going to temperament, you could have a highly sensitive child who may have struggled with attachment and who may just have a very, very small social network for herself and feels a sense of loneliness, and then is a very poor eater. So her gut flora is off. So you could have a highly sensitive child, look at the temperament, who may have a very small social network and who may be a very poor eater. Now that's psychological, there's your environmental factor, and then there's your biological factor, right? All of those come together to create depression or to create anxiety. So guess what, guys? All of those things are what we would try to tackle as we try to get the brain well without involving any medications in it. So attachment issues, thought patterns, people's emotions, how they perceive the world, what kind of trauma they've had, what sort of a culture do they live in, you know, a bunch of different factors will come in to play. So if you had gut issues, if you had some gut issues, wouldn't the doctor conduct some tests before he's going to see what's wrong with you, right? He's going to do some tests. With brain health, most doctors, like I said, pin the donkey's tail. Most people who've been on medications for brain conditions have had their medication switched on them multiple times. So that tells you that what the psychiatrists are doing is they're playing a guessing game, okay? The people who are really good at deciphering what's going on to the underlying issues are doctors that are naturopathic doctors. We've got a whole group of physicians who are trained, and they're trained to do primary care as well. They're board certified by the Medical Board of California, and they are able to get to what the underlying issues are, whether it's micronutrient imbalances, whether it's food allergies, food sensitivities. There could be a whole bunch of things that they're going to be able to get to underneath there, right? And what I have found, what makes my practice very successful and what makes my patients get well are integrative therapies. That's one of the big things that we've found that really helps a lot. So what I struggle with and that is that a lot of my patients who've been on medications, but the side effects of medications are very severe. Long-term side effects of these psychotropic medications are you have weight gain. So people start developing what we call metabolic syndrome. So you're on an SSRI, yeah, you're happy, but you actually are not able to have an orgasm because you have sexual problems. And then on top of that, you're starting to gain a lot of weight. And now your doctor has to put you on diabetes medication because of that. And then you panic. Like I had a patient who had been trying to reach her psychiatrist this weekend. She's been trying to reach her since Wednesday, and she's only on 10 milligrams of Prozac and could not get a hold of her psychiatrist. So she would have had what we call a serotonin withdrawal. And luckily, she's just begun to see one of my integrative doctors too. And so I was able to reach Dr. Luber and connect the patient and Dr. Luber so that Dr. Luber could call in the prescription for her, whereas her psychiatrist was not returning her phone calls. And this person could have gone into severe serotonin withdrawal. So you feel that dependency on the medication. And it's kind of hard because, you know, what happens is you end up really sort of struggling. And what a lot of my patients will tell me is that I feel better, but I feel very numb. So your mood may improve, but you feel numb. So that's the part that's a real struggle for a lot of people. So I always tell folks that if you have a child or yourself that's dealing with any brain conditions, you've got to do brain imaging. It's an organ like any other organ. Why can the doctors and psychiatrists actually now have blood tests they can do with you, where the test is going to come back and it's going to allow them to the blood test will come back and it'll tell the psychiatrist which medication is going to be effective for this patient and which one is not going to be effective. So we've got blood tests that can be done before they prescribe any medication. So if I ever have to refer to a psychiatrist, I will always make sure that it's a psychiatrist who does the blood work before they just fire off the gun and prescribe the medications. Because anytime a patient presents some symptoms, all that the doctors want to do is get rid of the symptoms. They don't want to go to the underlying issue. When you do any one of these brain imaging tests, it gives you more data. So you've got your functional MRIs, which it measures brain activity by detecting changes in oxygen. Then you've got CT scans, right? It's like using an X-ray on the brain. Now, the brain tissue does not absorb X-rays. So the CT scan is like a dud when it comes to giving us any details. The QEEG, which is what we do here, it's a brain, you put on this whole big cap, it's got 19 spots, and we go to the entire region of the brain to see the electrical activity of the brain and see where is the electrical activity awry. Because when I'm doing neurofeedback, what I'm doing is I'm resetting the electrical activity of the brain, because the brain is driven by electrical impulses. So we're shifting that around. The SPECT scan, I love SPECT scans because they give you a three-dimensional view of the brain and where blood flow in the brain is compromised. The SPECT scan will even show regions of the brain that have atrophied, that have, maybe you might have had a concussion like 20 years ago. It's going to show up in the SPECT scan, and it'll show. So we know that the region where it's going to show up, you will see some of the struggles you have in life may have directly got to do with that. And then we go in with neurofeedback and we go in and we stimulate that area and bring about some changes. So also the other thing that happens when we do brain scans is we're aiding accurate treatment and also reducing stigma, because it is an organ. We need to examine what's going on with that organ and then kind of take it from there. Yeah. And truly, medications do not have to be the first line of defense. Your pediatrician will refer you to a psychiatrist. What you want as your first line of defense is to get some talk therapy in there, get some brain scans done, get some analysis of what's going on in the brain, and really understand the organ brain. Neurologists cannot do anything about behavioral issues. They just don't, they refer you out to psychiatrists. Neurologists will refer you out to psychiatrists, that's it. So what we want to do is and lifestyle issues that are very significant for brain. So your nutrition, your sleep, your gut health, all of those. And I am becoming, you guys have already heard from me for years now in terms of how much I really encourage reduction of screens, period. I think for boys, no more than 20 minutes of gaming an evening. And the reason I say 20, 25 minutes is because the way the games are set up is it's at about a 30, 35 minute, 40-minute mark is when they get their first dopamine hit. So you want to prevent the brain from getting that dopamine hit so they don't get addicted to the game. And they just play it for a little bit of entertainment and then they move on. You want your kids to get bored with social media, and you want them to get bored with gaming. And the only way that can happen is if you give them a very limited amount of time. So if you have girls that are on social media, I would give them 15 minutes of time on social media, and then after that it turns off, no more than that. And especially then what happens is they start to get bored, and then they're like, oh, I need to do something else, and they'll start reading books before you know it, or playing games. So cognition is our thinking, right? So these are some of the factors that tend to affect cognition, our thinking patterns. Depression affects our thinking patterns. When we're feeling apathetic about the world, that can affect our thinking patterns. If we're ill, like you know, when you got ill, like you just couldn't like think about anything, especially if you had a head cold or whatever. If you have a lot of fatigue, that can affect your thinking pattern. In my clinic, when I treat any kids with ADHD, the first thing I do is I make sure I regulate the sleep for the child. Let me not start them on any treatment until the parents can start taking all the technology out of the room and have the child start to get 8 to 9 hours of sleep. When a kid who comes to me with ADHD, all the classic signs of ADHD, when I get their sleep regulated, about 60 to 70% of those signs. So it may not But I want to tease out whether there is clinical ADHD or is it environmental. So that's why when I reintroduce sleep back in there and we talk about sleep, then I'll see where the brain is at that point. Anxiety is a big one in terms of affecting cognition. When we feel overloaded, with things, and we know how much our cognition gets affected when we feel overloaded. Sleep, to me, this is like, for me, sleep, I'm trying to bring this guy over here. There you go. That's better. Okay. So for me, sleep is like one of the biggest gifts of healing we can give to the brain. What happens during sleep, there's this whole system called the lymphatic system. The brain cleanses itself in sleep. It organizes new information. It solidifies your memories. It clears out toxins in the brain. It regulates your appetite. It keeps your body healthy. It makes more efficient thought process. Like if I ever have a night where I may have had like maybe 6 hours of sleep or 6.5 or something where it's less than what I normally get, the next day I can tell automatically words won't come to me, right? I might try to remember something and the words won't come to me. So sleep really impacts our brain. And the biggest gift we can give ourselves and give our children is healthy, regular, consistent sleeping. And we just tend to shortchange, especially mamas. You guys tend to shortchange yourself on your sleep. It just makes me very cranky. And mentally healthy people, like, what do they look like, right? They tend to possess high self-esteem. They tend to accept imperfections in themselves and others. They're like, life is not perfect. People are not going to be perfect. They tend to want to give to others. And they feel a sense of agency in their life, right? They feel like they have a sense of control in their life. So people who are the reason why I like to have a good thorough list about this is because these traits are what can be aspirational for you. Even if you have a child who's 17, 18 years old, just a year away from college, doesn't matter. These are still traits you can work on cultivating in them. And when they have these traits, when they can lean on another person, when they can say, oh, I need some help. I'm struggling. I'm trying to get the garage cleaned up. Can you come and help me? Or different things like that. Then what happens is that then you feel a sense of connection with people. You feel a community with people, right? So we want to teach ourselves and our kids to think about, like, a good question you could ask your kiddos is, what do you think of mentally healthy people? Because our teens, preteens, teens, they all know what depression looks like. They all know about anxiety. They're all anxious and they're all feeling depression, right? But they may not know what a mentally healthy person looks like. So this could be a list you can kind of pull out and you can say, hey, you know what? Here's what a mentally healthy person looks like. What do you think about it, right? So a mentally healthy person does not get overwhelmed by emotions. Like, emotions have a place in their life. So I know that I am not my thoughts. I am not the sensations I experience in my body. I am me, irrespective of what my thoughts are, my feelings, and the sensations I have in my body, because I am this self, not my thoughts. I am not my thoughts. I am not my feelings. So a lot of times for teens and preteens, their feelings, that amygdala, the feeling brain, is just like online, and they tend to think that what they're feeling is them. What they're feeling is not them. What they're feeling is a state that they're experiencing. As a parent, you can say, and you want to validate that. You want to say, God, I can understand that you're feeling that. So they can be feeling that, and you can validate that, and at the same time say, but sweetheart, I know you're feeling that, but you do know that you're not your feelings, right? That you are more than your feelings. You are your values. You are the kind person that you are. You are this generous human being. You are this competitive girl in your sport. You are this, so that your daughters and yourself are more than our feelings, right? And people who tend to be mentally healthy also tend to maintain a positive outlook on life. They tend to be a little bit optimistic, right? And they're not afraid of commitment. They're capable of intimacy. There's a creativity. They'll show creativity. And the biggest one that I love is the one that's where they show persevere. I always talk about grit and perseverance, that kiddos who are mentally healthy and people who are mentally healthy, they'll hit an obstacle, but they'll keep going past it. Because failure is not a failure of self, it's a failure of strategy. And then they'll do some different strategies then. And they'll take reasonable risks in order to grow, and then bounce back. It's that resiliency. They have that resiliency and bouncing back. So resiliency is really the ultimate trait of a balanced, healthy brain. Suffering, obstacles, and roadblocks are all an inevitable part of a lived life. This gift is a trait that is very much cultivated, not inborn. Resiliency is a trait we cultivated. It's not something you're born with. It's something we parents can choose to educate and grow in our children and in ourselves. And I am a big believer, as you all know, that empathy is truly the bedrock of connection, of being real, of being able to like really be present with people. So we really want that empathetic. We want to teach our children how to be empathetic. We want to talk about empathy. We want to express, because a healthy brain tends to be an empathetic brain. You want your children to be sensitive. You want them to be kind. You want them to be empathetic. Some of them, because of their temperament, might end up being over empathetic, and they'll be those rescuers, and they're constantly like trying to, make things better for other people. And so be it. That's a Girl Scout. Girl Scouts will be doing that. That's just part of how they're inbuilt, So, and we want to teach our children emotional intelligence. And the way we can teach them emotional intelligence is if we talk about feelings. If we talk about our own feelings, and we validate our own feelings, and we recognize, name, and understand our emotions, that makes us emotionally intelligent. So a healthy brain is an emotionally intelligent brain. And some of you parents maybe like, I don't know emotional intelligence. And I love it if you can say, I don't know emotional intelligence. I want to learn how to cultivate that. And there are so many good sources and books you can find about how, even an article, how to cultivate emotional intelligence in myself. If you just Google that, you'll come up with some really good articles. But basically what people who are emotionally intelligent will do is they can recognize, they can name their feelings, and they can understand their feelings. And they can manage their emotions, and they can control their moods. Their moods don't come in like a tractor and take over everything, right? They can control their moods. The emotionally intelligent people are able to motivate themselves and get things done. They don't get stuck in the rut, and they don't get bogged down, because when we have emotional intelligence, we always have a finger on the pulse of our feelings. And when we keep a finger on the pulse of our feelings, we tend to remain very unstuck in life. We move through things pretty quickly. We don't ruminate as much, and we just tend to like move through, and we forgive others easily. We can like understand another person's perspective, particularly if we've cultivated empathy in ourselves. And they can tend to recognize and respond to emotions in others. So in my practice, I work a lot with folks that are on the spectrum. And I do, when I'm doing the neurofeedback training with them, I'll do a lot of right side training. I'll have sensors here, I'll have sensors here, I have sensors in the right back over here. And the reason I'm doing a lot of right side training is because I want to stimulate the emotional brain so that they can have more of a depth of understanding about others in the world, and pick up on somebody else's emotions and things like that. So that's and emotionally intelligent people can be socially competent. Like they can enter a room, or they can feel out the emotional pulse of that room. They'll be able to kind of feel the emotional pulse of that room. So what is the healthy lifestyle? So I believe we can make healthy brains via a healthy lifestyle. Okay. And they can all be, for me, nature is a very, 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 very big part of a healthy lifestyle. We have a condition that I call nature deficit disorder, where when we're so out of touch with nature, we'll be out of, because we're animals in this kingdom, right? We're not like whatever, we're not these superior beings that are not going to be affected by the cycles of the moon and the cycles of the tides and day and night. So we are a part of nature, and it's very important for us to just go into nature periodically and regularly to do a reset. Because when we go into nature, Japan has a whole thing. It's a tree hugging. They have a tradition of tree hugging, which is it's very healing for the brain. The other thing that they have in Japan is those, they have the mineral waters, the hot baths, and there's a lot of lithium in those hot baths. And because of that, depression rates tend to be very low in Japan, because the lithium levels naturally from your environment, you get a lot of organic lithium in your body. And that's, again, a micronutrient. Well, sometimes that's one of the micronutrients I'll have some of my patients take, which is, you can get it on the over the counter, and it's lithium orotate, and it's like brain food for the brain, which grows more neurons in the brain, and there's neurogenesis and things like that. So there's a whole lot like that can be done for the brain in terms of meditation and activities that strengthen the brain health. And that's your nature. We've got to reduce technology. Like, I'm a big one about digital breaks, like really, and being able to reach out and say, I need help. And doing yoga and journaling are very, 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 very important for brain health. So these are like, the brain is incredibly self-healing if we give it the right food. Brain exercise, meditation, neurofeedback. Some of my patients will say they can't meditate, and when they do a little bit of neurofeedback, because they've been able to get into that zone a little bit, the brain's like so smart, the brain picks up on it. A lot of my patients who've never been able to meditate, once they've had a few neurofeedback sessions and they've learned how to be able to drop down a little bit, they're able to start meditating on their own. And my aftercare program for my patients, once they finish my treatment here, is for them to be doing daily meditation. Children and teens take to meditation like this because they start to feel better. And we've got some really good apps for meditation. And you and your child can explore the apps and try 2 or 3 different ones, because there's so many out there. Try which ones appeal to them and appeal to you. And maybe you and your child, as you take a walk together, which is for exercise, maybe you sit down and you meditate together. So you become a family that starts to meditate. So brain exercise, brain nutrients. I'm big on omega-3s, nuts, vitamin D, like your Mediterranean type of a diet. And really looking at your food source, making sure that there's not toxins in the food source. And exercise is a huge part of the brain healing. We really want a lot of that. And breath, because when we live these very busy, hurried lives, we tend to stop breathing, guys. So we really want to start breathing again. We want to be able to bring in massage. We want acupuncture. Those are all the things that bring about balance in the brain. And teens need more than 9 hours of sleep. It's critical. And another food for the brain that I think is an important food is laughter. Laughter and connection and joy and play and boredom. Boredom is a very important brain food. Because we get tempted. If our kids are bored, we want to engage them in activity. When they're bored is when the brain is in that deep resting stage and the brain's actually healing and resting. So boredom is a gift we give our kiddos. That's truly a gift. Okay. So when we think about food, exercise, meditation, I'm big on acupuncture, very big on acupuncture. Alpha Stim is this device that I've used with a lot of my patients. It's like you put these little pidgey things on your ears. And what it does is it gives you a tiny microcurrent through the brain. And any of my patients who, like, say, might be in medical school or have very busy schedules and they want something for PTSD, insomnia, anxiety, the Alpha Stim has been a product that has been quite useful for quite a few of my patients. And it's very portable. You can go on vacation, you can take it with you, but it gives you a tiny micro stimulus into the brain that does a reset on the brain. And it's a powerful technology. That's a very good technology. And, I'm big on omega-3. We need vitamin D is not, I think many of you might have heard me talk about this before, but vitamin D is not actually a vitamin. It is a hormone. Vitamin D is a hormone that regulates all our other hormones. So if our hormonal system is out of balance, we're going to have brain conditions. If our hormones are out of balance, we might have heart palpitations. If our hormones are out of balance, we might have anxiety. If our hormones are out of balance, we might have insomnia. Then we'll go see a doctor and they'll give you Xanax. And before you know it, you've gotten addicted to a benzo now. So you really sort of want to think about getting your vitamin D. I've taken supplements, vitamin D supplements, probably for the last 15 years now. And most of the times when you take vitamin D, your doctors will tell you if you're around 25, 32, they'll be like, oh, it's good. And it can go up to 100. My goal for optimum brain health is to get people's vitamin D levels up to closer to 80. When it's closer to 80, then you're in really optimum state with your brain, because then sleep will be good, because vitamin D, deficiencies of vitamin D are implicated in sleep disorders. So it's very important to look at that. And then, your team will consist of a neurofeedback practitioner, an integrative psychologist. Make sure it's a person who is just not like most insurance companies, guys, by the way, right now, your insurance companies have been told if they are seeing a team or you or anybody, the insurance company tells the practitioner that after 6 sessions, they insist 6 psychotherapy sessions, they tell the practitioner that they won't authorize more sessions until they refer you to a psychiatrist. So our medical system is completely hacked in the direction of putting us on all these medications that create all these unnecessary side effects that are so not good. So that's why I say, think of an integrative psychologist, somebody who doesn't lean on meds right away. Naturopathic doctor, that's part of your team, acupuncturist. I think it's really good to have an integrative doctor, a chiropractor, like a holistic nutritionist. And then we've got TMS, which is that transmagnetic stimulation. And a lot of insurance companies are covering TMS. And I've seen a lot of people have good beneficial effects with TMS. I also have a lot of TMS providers. Get this, guys, a lot of TMS providers who are referring their patients who've completed TMS to me for neurofeedback, because I work with the whole brain and I'm able to go deeper and do deeper work. But the good news is that TMS will often get covered by insurance companies. And insurance companies still fight me on the neurofeedback, which bugs me. So some of the conditions that we're able to treat with neurofeedback, as you can see, are all of these. I have a lot of people with fibromyalgia, with OCD, with hot flashes, with hormonal imbalances, learning disabilities, depression, PTSD, pain conditions. I treat a lot of people with pain conditions, because remember, all of what I have on this list originates from the brain, right? So if I do any kind of brain training, of course, and the good news is we've got quite a few neurofeedback practitioners around San Diego. So there's a good group of us that are doing this work. I would love for you, in terms of resources, because I have 6:53 right now, in terms of resources, I would love for you guys to be able to go to my Healthy Within YouTube channel. I've got about 6 or 7 really good videos there that describe different things about the brain. And then, of course, lo and behold, during the pandemic is when I released my first book. Oh, wow, beautiful lightning out there. This is gorgeous. Released a book. So this is the book where I talk a lot about brain health. Some of what I talked about here, I talk about in this book quite a bit. And then one of my most favorite resources is the Greater Good Science Center at University of Berkeley. They have great tips, really good. They come very much from a holistic perspective. And I think that's the reason why I like them so much, is because they don't talk about medications. They talk about all these other things we can do within our family, with our children, and things like that. I am going to tell you that you owe yourself one hour a day self-maintenance. It can be reading, it can be writing, it can be yoga, it can be exercise, it can be dancing, it can be meditation, it can be painting, or whatever. But you owe it to yourself, ladies, because we know that if we don't put on our oxygen mask, then we're not going to be able to really work consistently to regulate the brains of our children around us and our family, right? So we have to feel deserving of 1/24 of your day. Less than 5% of your day you give to self-maintenance. When you will do that, you'll start to see the tempo in the family coming down beautifully. These are some of my books that I really, really like. The Secrets of the Teen Brain, The Teenage Brain, Raising Children with Grit. That's really good book. And then, she's talking a lot about reclaiming our conversations because, the kids have stopped. Our children and our families have stopped learning how to converse. So we've got to be able to teach them. I've got my Instagram. We've got all this, as I say this, and there's all this drama going on with none of the social media channels being on. Apparently they got hacked today. I give a lot of really good brain tips on my Instagram channel and my Facebook channel. So just be sure to look there. And then my YouTube videos are very useful. A lot of people really like that. And I really want your life to have simplicity. I want laughter. I want there to be sweet, simple pleasures in your life. And may you be grounded in kindness, and may your family be grounded in kindness and empathy. And really, let's work on killing this materialism, because this materialism drives me bananas. So I want to just thank you for this sweet time. So question, click to exit. How am I exiting this? I want to be able to see my participants, and I want to be able to see the chat. So what kinds of questions are coming up for people?
We do have a question in the chat. If Cassandra wants to ask it out loud, otherwise I'm happy to read it.
Yeah. Cassandra, you want to ask it out loud?
Sure, I can ask it out loud. Hi. Well, what I wanted to know is, what you talked about the effects of like social media, but I wanted to know, what is the effects of being online for extended amount of time, specifically for children who are homeschooled? Because my daughter, she is homeschooled, and so her school is online, and then her social interactions, because everyone is in different states. Yeah. So her social interaction is play dates with her schoolmates after school. So they're still on the computer with each other, playing in the background and, playing different games and whatnot. So I don't know, that's the only social interaction that she really has, because we're all in different states, but they're her classmates.
And how long has this been the case for your daughter? How many years has it been like this?
So she started being homeschooled last year around January. So since January
2020. And how old is she?
But before that, when she was in the regular school system, that was all online too. But with her now being homeschooled, it's like the social interactions with the classmates, it's necessary, because there isn't any other social interaction, because the homeschool programs or, dates here in our local city, I work full time. And so whenever they have different things, it's during the day, during my work hours.
Got it.
And so it's like I'm definitely having her with her classmates online so that they can interact, but it's extended hours.
How old is your daughter, Cassandra?
She's about to turn 9 next month.
9 next month, yeah. I have a strong proclivity, especially if you're doing online schooling and her socializing is all online too. I think what that means is that on the weekends, that I would look for groups that she can do more things with, because what ends up happening is that because she's not getting that 3D interaction, with other children. And when we're with other children, age 9, age 6, age 7, age 8, age 9, there are different developmental markers that we are kind of crossing through, and it's enhancing the brain in a certain way.
Okay.
There's a process that happens in the brain called pruning, Pruning, pruning. It's like pruning a bush. Whatever we expose our children to, those regions of the brain flourish and blossom. And what they don't get exposed to, those regions of the brain shrink away and they kind of disappear. So her ability to form social connections in person in 3D is a very necessary part of a 9-year-old, a 10-year-old, an 11-year-old, a 12-year-old, a 13-year-old, a 14-year-old. So because the teenage years, the ages between age around 11 and 22 are the times of the most amount of vibrant growth for the brain. So that's the reason why you want to expose the brain to languages during that time. That's the reason why you want to expose them to music. You want to expose them to a lot of socio-emotional interactions, whether it is within her Girl Scout troop or it's a church group that you guys go to. But I would set up tons and tons and tons of play dates for her on Saturday and Sunday to make up for the deficit that she's definitely getting with everything being online.
Got it. Thank you so much.
You're welcome. You're welcome. Anybody else? Question? Please feel free to like show up and come and speak, and because I love all the faces that are there.
I don't necessarily have a question, but I wanted to say thank you because this is definitely a different area that I wasn't as familiar with. And I've got a 17-year-old son and a 14-year-old daughter. So in addition to the Girl Scout troop for senior troop that I work with. So it's really interesting. And yeah, I definitely need to look into that.
Yes.
See what, I guess what's covered and how to go about trying to be more engaged. So I'll check out your YouTube videos and your website. I just bookmarked all of that so that I can look at it more in depth.
Yeah, check out my YouTube videos. And I think also, you know, we're in such an unusual time right now. And it was so funny because I do a lot of presentations with Teen Volunteers in Action, NCL, Girl Scouts, lots of teen parent groups. And they've all heard me talk about it. My biggest thing I tell my parents, which I'm like, it's going to go over your head, but I'm going to say it anyway, because they'll always ask me, oh, when should we get our child a smartphone? And I have an answer to that. But I always tell them I have an answer to it. But my guess is you're not going to believe me, or you're not going to follow the advice I'm going to give you because you want to get your kid's brain messed up, then by all means get it messed up. But I now, in the last 2 years, Hilda, I have been telling parents to wait until second semester of senior year of high school before you get your kid a smartphone. Because I see the damage. All of us in the mental health world, since 2007, when iPhones and iPads and all that came out, there's an exponential rise in teen anxiety and depression. And if you read all these Wall Street Journal articles that have been coming out in the last 7 to 8 days, they even have a huge podcast going on, you will see exactly why the kids are getting so messed up. And gaming, I'm a huge, like gaming, 20 minutes a day. That's it at the most. Most of my parents who are the younger ones, they don't even let them game. If they have drank my Kool-Aid and they believe the science I give them, then their kids don't even play any video games on weekdays. They just give them a half an hour on Saturday and a half an hour on Sunday. Imagine that. That child looks at people in the eyes when they talk to them. They interact with them. They have empathy. They care about others. They really become engaged in the world. Yeah.
Good. Yeah, I can imagine. Thank you.
Yeah, absolutely. Any other questions? I know we're at 7:04 and I don't like to go over too much because everybody's in the middle of preparing dinner and everything right now.
I just hearing that whole second year of high school. So I feel like I've already I've crossed that threshold. I have damaged her so far, so much for so many years already. How do we reverse it?
The word for it is neuroplastic. The best way to reverse it is to yank it away from them, get her a flip phone. Get her a flip phone. She'll be pissed as anything with you for about a year and a half. But guess what? All my parents who do that, they tell me that within 6 months, they see glimpses of their sweet little girl kind of popping back again into the picture. Because if you read some of these articles that are coming about the impact of Instagram on the self-image and body image of girls, it is horrendous what's going on. And they know what they're doing to the psyches of young girls, and they don't give a flying hoot about that. So you know, kind of like when the trains left the station, you can pull the brakes. You can pull the brakes and you say, I'm your parent. And you can become the parent. You can decide to become the parent and say, with everything I'm reading from these Wall Street Journal articles, I am giving you cocaine for your brain. I am yanking that cocaine away, and I'm going to get you a flip phone. And then they get so bored with the flip phone that they hardly use it, but you need them to have a phone in case they need to contact you. I like my teens who start driving. I don't like them to start using maps from the day one when they start driving, because when they have to figure out how to get to places and they write down directions and they follow the directions, then they're developing a cognitive map, the way we used to do it in olden times, okay? That develops brain strength. And the brain is very neuroplastic. Anything you yank away from the brain right now that we know is being detrimental to that brain, what will start to happen is that brain will start to grow new neurons in those regions where it was not growing the new neurons. The empathy neurons come back in again, the mirror neurons come back in, the brain starts to generate itself in a lot of different fascinating areas. You haven't damaged her. You've just been doing whatever everybody's snorting this coke. You've been snorting the same coke that I mean, look at how addicted you might be to your Facebook. I mean, give me a break, you know? So that's why I say we deserve to give ourselves that 1 hour of a gift of self-care for ourselves. We deserve to breathe. We deserve to do yoga. We deserve to read. Wow, look at that thunder. Oh my God, it's beautiful. Wow. We've never had so much thunder in San Diego until this year, right? I don't recall having this much thunder.
Yeah, and all the lightning. It's like, wow, it's quite a show.
It is, and I'm near a window so I can see. Yeah, so I think what I want all of you to do is feel very empowered to recognize that there's an organ that's actually 3.5 pounds, but it's like the most important organ of my child's body and my body. And starting today, what am I going to do to give that brain the best nourishment I can give it? How am I going to give my brain sleep? How am I going to give it good food? How am I going to give it good, consistent exercise? How am I going to give my brain awe? Because the brain loves awe. The brain loves nature. The brain loves connection. The brain loves laughter. The brain loves boredom. Believe it or not, the brain loves boredom because it's in boredom states that we have this gamma wave activity that's called the aha. It's gamma wave activity that comes out in boredom states. Jennifer, it was so good to see you.
I know, I was just going to say hello to you.
I saw you. I'm like, she's here.
Oh, it's so great to hear from you. And I know you
add. As a psychologist, what are you going to add?
Yeah, I know. I said I don't need to back you up at all because
no. Add some stuff.
Listening to you. But for those who don't know me, also as a psychologist in the area, just everything that you're talking about is so true. And I really, see the anxiety and depression that's up really high. And a lot of it is, stems from social media and this constant connectivity on the phone. And for the mom who was just speaking and saying, I'm afraid I've, done my kids wrong at this point. How do we reverse any of this? And I think too, for people who feel like they can't reverse, I don't want to undo what you're saying, but if they feel like that needs to be a part of their life, helping just kind of build boundaries around it. The kids don't know the boundaries. And unfortunately, as we know as adults too, those phones never stop. There's no, it's not like we walk out of school and we're done for the day, or we walk out of work, we're done for the day. It continually feeds us. And so helping build boundaries around that is helpful.
Yes. And Social Dilemma, if any of you have not seen that documentary, please watch it. How do you say? Dilemma, Social Dilemma. I think the spelling is wrong, but Social Dilemma. Really watch that documentary, because then you'll see exactly, because a lot of the people who worked in big tech are the ones who created. And Tristan Harris is the one who is a leader in forming humane technology in the world. So he's I love listening to his podcasts and everything he does. His name is Tristan Harris, and he really talks about establishing boundaries and having humane technology, because I think we can do that. I think our Girl Scouts are really good with knowing how to leverage technology when they're doing their silver awards and their gold awards and everything like that. And the Girl Scouts become really good about knowing how to regulate some of that. And many of them have done, like, if you guys haven't seen the projects that some of our Girl Scouts, we had 87 Gold Award Girl Scouts, right? This is the largest number we had this year, 87. We've never had that. Wow. But if you look at some of their projects, there's a lot. They're already aware of the impact that social media is having on them, but then they also know how they have to leverage it in a positive way to use it for their social causes as well. So yeah, I'm not necessarily demonizing it. I just think that it's a drug, it's cocaine. The longer you delay exposing them to cocaine, why not? So their brain will only grow to a healthier brain. That's all. Social Dilemma is a really good one. So Megan, I'm good. I'm good to wrap up here. If you think we're good to wrap up here, in case anybody else has any other questions. And you guys have my email. I think my email was on that other one. Oh, was my email on this one? One of them had my email.
I think one more back.
Back?
Maybe not. It was there.
Will you be sharing the slides?
I'll be sharing the slides. How can I share the slides?
Yeah, you can send them to me and I will put them in our Dropbox that we use. And it actually has all of what was going to be VC, we're now calling Welcome Home All Fall. Every session, sorry, you might be able to hear the thunder in City Heights now. When any session had handouts or slides or things they wanted to share, each session has a folder. So I'll create a folder for you and we can put that in there. And we can also put the recording, hopefully, of this session in there as well. You just might need to make a Dropbox account because the video will be a lot of data.
Yes. Yeah.
So
I'll send them to Megan and then Megan will put it in the Dropbox.
Yes, I can give folks the Dropbox link right now before it even exists. Put that in the chat for you.
And if you haven't had a chance to watch Social Dilemma, please do so. And please download all these Wall Street articles. They are, my jaw's dropping. 60 Minutes, we had the whistleblower on 60 Minutes last night. And I want to go home today and watch the extended version of it because she's got some really scary things that she's talking about. So we need to, oh, you're welcome, Cassandra. You're welcome, Valerie. I'm glad. It was really, I enjoyed talking with you guys. I like more interaction, but there's some content I wanted to cover. So I wanted to be sure I get through most of that, Good. Thank you, Hilda. All righty. Good. Okay. Well, take care, everybody. Have a good night. And then we'll see you guys later. All right. Bye.
Thank you all.
Bye.